So, I see we have you in today for a foot examination. Looks like on your chart you have described experiencing some discomfort and pain, as well as a little bit of restless leg syndrome. So today we are going to examine each of your feet very, very thoroughly, and then figure out what the best course of treatment is going to be. So, to begin, we are just going to start with a basic visual examination of each foot. So, I'm just going to take this foot here and examine it, looking at the toes one by one. Good. And when I palpate your toes, do you feel any pain? No? Good. And good. Just checking for any signs of calluses, corns, stress fractures, any kind of swelling that will indicate any kind of tendon inflammation. And I'm going to feel down here along the 5th metatarsal, which is the most prone to stress fractures. Okay. And we're going to put that back down, and we go to feel and articulate your foot up. Good. And with me holding your foot here, go ahead and clench your toes all the way down. Good. And release. Good. And with me holding your toes, try to clench them down. Good. And release. Good. Good. And then I'm going to just press your foot down this way. Do you have any pain when I press like this? Good. And we're going to press. Good. 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 Force against me. Good. All right. And feeling down on the Achilles tendon here. Make sure that's intact. Good. All right, and just turn your foot inward for me. Good. And we're going to check that arch. Any pain when I run my finger along your arch here? Good. And how about up here to the pad of your foot? Any pain when I palpate? Good. And down. Let's just turn that in as much as you can. Good. Good articulation there, and outwards. Good. And when I squeeze the sole, any pain? Good. Okay. We're going to let that one rest for a little bit. And we're going to take a look at the other side. So we're going to do the same thing. We're going to do the visual examination, looking for any signs of injury, distress, swelling, corns, anything like that. This might be a small area of concern. And do notice a little bit of swelling here. Is this a little bit tender? Yeah, okay. So you might actually have some bruising on the metatarsals there, but we can examine that. And if we find that we don't find anything today, we can always send you in for an x-ray. So we'll get that taken care of. So I want you to turn your foot inwards. Good. Again, I'm going to palpate along the 5th metatarsal, looking for any signs of stress fracture. Good. Good. All right, and turn your foot out. Good. And let's look at that arch. That feels very, very if I palpate here, yeah, that is extremely tight. So we're going to work on that today for you. We are going to do a little bit of a clinical therapeutic foot massage therapy for you. Good strength on the toes. Go ahead and try to grip my finger with your toes. Good. All right, let's open those. Now I'm gonna push your foot back. You push against me. Ready? 1, 2, 3. Push. Good. Stop. Do it again. 1, 2, 3. Push. Good. Good, good, good. Okay. And I'm going to do the same thing here. Try to lift your foot up. Good. And relax. Relax, relax, relax. Good. Alright. So, do you see a little bit of swelling here? And we definitely have a lot of tension down here along the arch. So we're going to work on a massage for that foot. And I'm going to just bring this foot back up. I think I noticed a little bit of possibly hammer toe developing here, so we may want to send you in for some x-rays just to see how that's developed. Alright, so just relax for a moment. Alright, so now I want to test some of your muscle and reflexes. So I want you to push down on my hands with both feet. Good. Relax. Alright, and do it again. 1, 2, 3, harder. Alright, relax. And one more time. 1, 2, 3. Good. Okay, now can you splay open your toes for me on each foot? Okay, good. Can you turn this foot in a little bit? Can you splay these toes? No. Okay. And this one right here, not a lot of movement. Okay. Do you have any pain when I palpate down? Alright, good. You can relax that foot. And this one, much, much better mobility and flexibility on this foot. Just want to make sure we take care of this area right here. Okay, good. Good. Alright, can you lift both your feet up? Good. Good. Alright, now push down again. Good. Relax. And push down again. Good. And relax. Good. Good, good. Alright. So now I would like to do some reflex tests. So I'm just going to take my little reflex hammer right here, as you can see, and does not hurt. So we're just going to test your reflexes on a few areas of your feet just to make sure everything's working. So you let me know if there's any pain. And good. Okay. And we're going to go inside, and we're going to go inside, and okay. And on the other leg. Good. And good. One more. Good. Alright. And now we are going to do some sensation tests. So if you would not mind, and just close your eyes for me. I am going to do a little sensation test on your feet. So I'm either going to touch you with the dull object here like that, or the semi-sharp object like that, okay? Alright, so you just let me know which object it is. And good. 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 Alright. And we're going to keep doing the same kind of test, except this time I'm going to use a acupressure tool like that, or the cotton swab like that. So you just keep your eyes closed, and you let me know which one you feel. Good. 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 Touch. Good. Touch. Good. Touch. Very good. Touch. Good. Alright, you can put that one down. Rest that foot. And we're going to do the same thing on this foot. Let's just lift that up. And touch. Good. Touch. Good. Touch. Good. Touch. Good. Touch. Good. Alright, you need to put that down. Alright, so now that we've done the basic reflex test, I would like to test some of your pressure points with my acupressure tool. And it's very dull, and it has a lot of give. So you can see when I press on your toe, it will not hurt. But if you feel any pain, you let me know, okay? So we're just going to test different points around your foot. So we're going to start with the inside here. Down on the sole. And press and wiggle. Any pain. Good. Good. Alright, let's just let that one relax. And we're going to do the same thing. Let's just turn that in a little bit. Turn it in. Good. And good. Good. There's definitely a lot of tension here. So we're going to definitely spend quite a bit of time on this foot with the therapeutic massage. Right there. And right on. Yep. See that reaction right there? Lots of tension. Let's see if we can actually... Good. Alright, let's check the toes. Good. Good. Alright, and that one, we're going to skip this area that's a little swollen. Check that, and check that. Good. Alright. So now I think we are going to move on and work on your clinical therapeutic massage. So I'm just going to take off my gloves real quick. Alright, so we're just going to grab a little bit of foot lotion here so that we have some lubrication for your feet. So we're just going to get started with this. gently massage the whole foot. Alright, so I'll just let that one rest for a little bit before we overstimulate your nerves too much, as we are going to be using some specialized tools to help release a lot of the tension that you're holding in your feet. And if you fall asleep at any point during this exam, that is absolutely okay. So, if you wouldn't mind. Thank you. Alright. So again, we're just gonna massage the whole foot over gently, taking care of this slightly swollen area. Okay. Alright, so now we're going to move on and use a couple specialized tools to help release a lot of the tension. So this tool is going to actually slip over the toe just like this and massage out all the little tendons and muscles inside your toes. So we are going to just start with your big toe here. We're just gonna slip that on and just give it a nice gentle roll, roll, roll. Good. Be very gentle on the hammer toe. Just a nice gentle roll. Good. And over to this toe. Good. And over to this one. Good. Little gentle roll. And to the pinky toe. There we go. Nice little roll. Those pinky toes can be a little stubborn sometimes. Alright, and over here we're going to go right over the big toe. Good. And use this little roller part, and we're just going to just gently roll. Just gently roll. And then just lift up a little bit for me. Good. Definitely a lot of tension in here. We actually have a stronger tool for this, so we'll get on that soon. Alright, so let's relax that foot. Good. Alright, let's move over here to this one. Good. Side. Good. Alright, there's definitely a lot of tension being held at the bottom of your feet, so we are going to get a little deeper and more a little aggressive with these right now. So, I have a special massage tool here that is specifically designed to help really stretch out the fascia of the muscle and help release a lot of tension. So we are just going to just gently lift up your foot here, and we are going to just run that up. I think we need to get a little more lotion on this. And let's look at this one too while we're at it. Alright, so let's release that tension. There we go. There we go. Good job. Most people can't take this kind of aggressive massage on the foot. Alright, so let's let that rest. And let's move on to this foot, where we're going to be a little more gentle. let's just give these just a gentle cool down. Just a gentle cool down. Just feel around, make sure that we got at least some of that tension out, but I'm going to want to have you come back for a follow-up in about 2 weeks or so. Alright, and what I want you to do today is I want you to go home, and I want you to relax, and I want you to stay off your feet. So kick back on the couch with your favorite show, or your favorite book, or your favorite music, and I want you to just let these feet relax. And don't forget to get a good night's sleep tonight.